So, hello everyone, and thanks for tuning in, guys. And yes, it is Mental Health Monday. I hope this Monday finds you happy and healthy, and I hope you guys had an awesome weekend. So, guys, I am here with your Mental Health Mondays, and if you're new here, guys, I do Mental Health Monday on Mondays. On Wednesdays, I do Wind Down Wednesdays. I do cooking, cleaning, motivational. I also do DIYs. I also do gardening. I have a large niche. So guys, if you would like, check out some of my other videos also. But guys, on today we will be talking about autism. So guys, I'm not a doctor, I'm not a nurse. I'm just a young lady that comes out and talk about the mental health piece so that people in my community can know it is okay to get help, seek help. And if you have to see a therapist, it is okay to do that. So guys, I want you to know a little bit about autistic people. Autistic people may act in a different way to other people. Autistic people may find it hard to communicate and interact with other people. They may find it hard to understand how other people think or feel. And autistic people find things like bright lights or loud noises very overwhelming, stressful, and very uncomfortable. Most people who are autistic get anxious or upset about unfamiliar situations and social events, and they may take longer to understand information. And autistic people do or think the same over and over. So, guys, the reason why I talk about autism and autistic people is because my granddaughter was diagnosed as being on the spectrum. And also, I want you guys to know that is considered a mental illness. Autism, when they say spectrum, I don't quite understand, because that's why I think they say it's spectrum, because there's so many broad ranges for autism. And different people have different types of autism, because you have verbal and nonverbal. My granddaughter is very verbal. She has more on the aspect of the behavioral part, where she can't control her behavior like she should, and she has to be constantly redirected and have to learn how to deal with different situations and going around certain people she's not familiar with. She acts different, or if loud noises, you will see her probably put her hands over her ear, or she'll clap or make some gesture like that. But guys, autism is not an illness. Okay, being autistic does not mean you have an illness or disease. It means your brain works in a different way. For people who are autistic, their brain works totally different. It's something you're born with. Signs of autism might be noticed when you are very young or not until older. So it comes out at different times. So for my granddaughter, I think she was diagnosed probably when she was around 5 or 6. And that's when we found out. So she's now 9. It might have been 4 or 5-ish. But that's when we found out, because she started having some issues, and her primary care physician referred her to a neurologist. And you have to go and get a diagnosis. Like I tell you guys, sometimes a primary care physician cannot diagnose things. He's going to direct you to where you need to go to get the help that you need. So guys, if you're autistic, you're autistic your whole life. Autism is not a medical condition with treatments or a cure, but some people need support to help them with certain things. Autistic people can live a full life. Being autistic does not have to stop you from having a good life. Like everyone, autistic people have things they are good at, as well as things they struggle with. Being autistic does not mean you can never make friends, have relationships, or get a job, but you might need extra help in all these areas. Autism is different for everyone. Autism is a spectrum. This means everybody with autism is different. Some autistic people need a little or no support. Others may need help from a parent or caregiver every day. Some people use other names for autism. There are other names for autism. used by some people, such as autism spectrum, which is ASD, and it is the medical name for autism. Asperger's, which you don't really hear them use Asperger's as much now, but they used to use Asperger's. Asperger is used by someone to describe the autistic people with average or above average intellectual. Okay, people with Asperger's do not have the same learning disabilities that many people with autism have, but they might have a specific learning difficulty. Some people call this high functioning autism, because there's some kids that are high functioning autism that you may not even know they're artistic, because what people fail to realize, most artistic children are very intelligent. They're very smart. Okay, because it says some people call this high functioning autism. Doctors do not diagnose people with Asperger's anymore because it's now thought of as a part of autism spectrum disorder. So they used to use Asperger's back in the years, quite a few years back, but now they don't use it. But if you were diagnosed with it before, this will stay with you, and that will be your diagnosis always. So we know it is not clear what causes autism. Nobody knows what causes autism, and we don't know how it comes on. But it can affect people in the same family, so multiple people in the family can have it. So it sometimes be passed on to a child by their parents. If the parents are autistic, the child can be autistic too. And it's not necessarily always passed on, but it can be passed on. It's not caused by like bad parenting. It's not caused by vaccine. Because a lot of people at first were saying autism was caused by the vaccine. And it's not linked to the diet. And it's not an infection that can spread to other people. And that's what I really come out to talk about, guys, because a lot of people think, if you're with someone or you're around someone, you can get autism from them. It doesn't work like that, guys. Autism is something that has to be diagnosed by a doctor and not your regular primary care physician. It's like a psychiatrist, psychologist has to diagnose that. So guys, autistic people can have any level of intelligence. So they're usually very high intelligence. And it's something that they like to do, because most people who are artistic or has Asperger's, they're really good at drawing and they're really good at blocks and things like that. Some autistic people have average or above average intelligence. Some autistic people have a learning disability. This means they may find it hard to look after themselves and need help with daily life. But artistic people may have other conditions. So it's other things that line up with them being artistic. If they're artistic, people often have other conditions such as attention deficit disorder, which is ADHD, dyslexia, which means they see things opposite, anxiety, which we all know anxiety is getting upset, heart racing, depression, and we understand what depression is. So what they're trying to let you know is if they have autism, they can have other things along with it, and they can also have epilepsy. So guys, the reason why I come out and talk about this, because I want to let you guys know the importance of being able to recognize children, adults, or people who may be artistic. You may have someone working around you. You may not even know they're artistic, but or you may know of a family member that may be artistic. Like for me, my granddaughter, or a loved one. But guys, the reason why I talk about autism, because we see a lot of kids that are out, and school's out once again, and it's going to be a lot of parents have their children out in, if they're taking care of them for the summer, or they may be out with the children and be in an environment. If you see kids that are having some issues, like they don't usually do good around people, they may be acting out, they may be screaming or hollering, just guys, try to just be kind of nice with be understanding toward the parent, because they're the ones who have to come out with their children and try to deal with it. And they're trying to learn how to they're trying to normalize dealing with the life that they have been dealt with, which is not a bad thing, because it's a lot of people that have different mental issues that are living every day. I'm an example of having a mental health issue. And guys, it has just opened up my knowledge to learn more and more about the different types of mental health issues so that I can come out, share with you guys, let you know. So guys, autism isn't a disease, none of that. But guys, I suggest that if you are concerned about anyone that you may know that has a mental issue, take some time to get yourself educated on it. That's the best thing you can do. The more you learn about it, the more you can help someone else. And the more you can recognize and be aware that it's a lot of people that have mental health issues and they're around you and you don't even know it. And then you could also be the very one that someone calls to talk to and relay to you something they may be going through. Maybe a parent that may have an autistic child, maybe a friend, a neighbor, a loved one. So guys, I just want to let you know that there's a lot of people out here dealing with different types of mental health, and mental health is real. So guys, that is your Mental Health Monday for today. I just like to say, if you're new here, thanks for coming out and checking out the video. I really appreciate you. And I want to say thank you to all my ride or dies that have been here the whole time. I really appreciate all you for stopping by. Hope you have an awesome Monday. And guys, don't forget to like, share, hit that notification bell so each time I load a video, you are there. So have a great one, and I'll see you in the next one. Bye-bye.